We have with us today Dr. Raja Dhar from the CK Birla Group of Hospitals, Kolkata. We welcome you, sir. First of all, sir, pulmonologists have had a very difficult time, especially during COVID. For all the trauma that the people had to face, pulmonologists were constantly by their side. How was that experience, and how do you think the country's been able to come out of this tragedy?
So Nihal, I think you're right. It was difficult times. It was times when you would be in a PPE, your classes would be clouded, you wouldn't see people. There would be ambulances from which you would have dead bodies coming out. And you would have personal tragedies in the family, amongst friends to deal with. So there were difficult times for sure. However, having said that, it also gave you a sense of ownership. So during COVID, we felt we were frontline warriors. We felt as if we belonged to the army. We were soldiers fighting a battle. And I think this sense of ownership, the sense of a specialty leading a huge battle, a global battle, gave recognition to the specialty. It was at the cost of a lot of morbidity, at the cost of lives of some of my colleagues. But I think at the end of the day, the fact that it all turned around and we managed to overcome this huge pandemic has also taught us a lot going forward. I think we have learned things during the pandemic which will hold us in good stead going forward, even during normal times.
Sure. The reason why India was able to come out of the pandemic the way it did, vaccination had a very, very major role to play there. And for the vaccination to be developed, medical research had a very important role there. Since you're part of the ICMR, the Indian Council for Medical Research, what do you see as the future for research in India?
I think medical research generally and research in lung diseases in pulmonology has moved forward a lot. So we've now got about 15 pulmonologists in the country who are within the global 2% best researched, best published in the world. And that's a huge achievement. 2% in a specialty is a very big thing. In the specialty, if you look at medicine altogether, we've reached number 5 position as far as publications are concerned in the last 3 years. So I think things have changed a lot. There's a lot of original research coming out of India. The best journals in the world have papers being published. In our area, we have researched on bronchiectasis and we've published in the Lancet about 3 years ago, and then again in the European Respiratory Journal. Got about 2,500 patients from throughout the country, and this cutting edge research which is coming forward in various areas including bronchiectasis. The new generation clinicians, the youngsters, are now, along with learning clinics, also interested in how to do research, how to take research forward. And I think these are bright times for India. Especially during COVID, there was a lot of papers from India that came out which got published, and even pharmacological trials started in India, which was something completely different and new.
Sure. The foundation for a good doctor is laid down in medical school itself. And since you consider academia to be so close to your heart, how do you think medical students these days, how are they being raised, and how do you think that can be improved over time?
So I think as far as medical training is concerned, let's think about this, Nehal, in 2 different fractions. Let us think about undergraduate training and let's think about postgraduate training. And if you look at the number of people who get into MBBS now, we are close to about 1 lakh every year. So it's a very large addition on a yearly basis of doctors. The challenge that we have in this country is lack of uniformity in training, both in the undergraduate and in the postgraduate section. And I think the first thing we should, as a community, with the help of the government, do is to bring about uniformity of training. It doesn't matter whether you're being trained in the tertiary care center, the best center in the country, or whether you are in a tier 3 or a tier 2 city getting trained. I think it's important that some basic virtues remain similar. And I think that's what we are aiming for. We are trying to come up with a basic curriculum where training becomes standardized. For postgraduate training, I think it's a different ballgame. There's a lot of interventions, there's a lot of hands-on things, both for the surgeons and physicians, that the doctors need to learn. And I think the way forward would be virtual reality platforms, VR platforms, and the world is going that way. When I was a doctor, when I learned becoming a doctor about 20, 25 years ago, it was always on the patient. Now that's, in a way, unethical to an extent because you're not learning on unwell people. And I think if we can set up virtual reality platforms, if we can have mannequins to train on, that would elevate postgraduate training to a different level altogether. And again, there'll be a lot of uniformity in what people learn throughout the country.
Sure, I'm very glad you brought that about because, of course, the young doctors, interns, they're learning, but there is, at the end of the other side, there is a live person whose life is as important as the doctor or other people around them. Lastly, I'd like to speak to you about preventive healthcare, especially because during post-COVID, we've realized that anything can hit us at any time. God forbid, if another pandemic were to hit us a few years down the line, how well prepared do you think India is, or how is India preparing for that?
So I think you said something very important a little while ago, Nehal. You spoke about vaccination. And I think we have shown the entire globe that if you have foresight and if you have the passion, then even in a country of 140 crores, you can vaccinate 90% of the population with at least one dose of a vaccine. I think that's been a huge learning. Post that, we find that even other adult diseases like influenza, like pneumonia, whooping cough, shingles, hepatitis, the consciousness about getting vaccinated in the adult population has actually skyrocketed up. It's become much greater as compared to what it was before. And I think that's one area we need to be more conscious about. There's new vaccines coming in, even in respiratory viral illnesses like COVID, like respiratory syncytial virus, like the adenovirus, when new vaccines are coming in. And that's one area of preventive medicine which is very important to adopt, even if you're trying to prevent another pandemic from happening. As far as pandemic preparedness is concerned, I think the other thing that we have learned is the mode of seeing patients from a distance. The online media is something which limits us to an extent, but it's much better than not seeing a patient at all. Even seeing it beyond the screen or listening to the voice on a WhatsApp call, I think gives you some understanding of how sick people are. And I think that's something to stay with us for the long term, especially in a country which is as scattered and wide-based as India is, and where specialists are scarce. So I think that's another learning from COVID that we'll take forward. I think the learnings about the pandemic should remain. We should have pandemic preparedness in the way of drills that happen from time to time throughout the country. Hopefully we wouldn't see another pandemic during our lifetime, but I guess anyone's guess, and more chances than not that we will probably see at least an epidemic, if not a pandemic, within the next 10 years.
Sure. So to keep the lessons and let go of the bad memories.
Absolutely.
It was an absolute pleasure speaking with you, Dr. Dhar. Thank you very much.
Thank you. Thank you so much.
Thank you, sir.